Today, we're going to talk about porencephalic cysts. This is a rare neurological condition that can affect the brain's structure and function. A porencephalic cyst is a fluid-filled cavity within the brain's cerebral hemisphere. These cavities contain cerebrospinal fluid and are lined by tissue that used to be normal white matter, but has since become gliotic or spongiotic due to loss of healthy brain cells. These cysts can vary in size and location. Some are small and asymptomatic, while others are large and extend over significant areas of the brain. They may be unilateral on one side or bilateral on both sides, and they may directly communicate with cerebrospinal fluid spaces like the ventricles or be separated by thin brain tissue. There are two main types. One, congenital porencephalic cysts, which develop before birth due to injury to the brain's blood supply, for example, from lack of oxygen or bleeding in the womb. And two, acquired porencephalic cysts, which can arise later in life after events such as trauma, infections, surgery, or stroke. Because of these origins, porencephalic cysts are often linked with developmental issues or neurologic symptoms. For congenital cases, symptoms can include cerebral palsy, seizures, learning disabilities, and motor impairments, depending on where the cyst is and how much brain tissue is affected. In adults, porencephalic cysts are particularly rare, but when they do occur, they can lead to neurological issues. Even unusual presentations like cerebrospinal fluid leakage from the ear or nose, as reported in literature. Diagnosis is largely based on neuroimaging. On CT scans, porencephalic cysts appear as well-defined areas filled with fluid that match the density of cerebrospinal fluid. On MRI, these cysts follow the same signal characteristics as cerebrospinal fluid on all sequences and do not enhance after contrast, helping distinguish them from other types of brain cysts. Differential diagnosis is important. Porencephalic cysts can be confused with arachnoid cysts, schizencephaly, or neuroglial cysts, but key imaging and clinical details help radiologists make the correct diagnosis. Treatment depends on the symptoms. Many people with small or asymptomatic cysts require only observation. When neurological symptoms like seizures or increased intracranial pressure arise, management may include anti-epileptic medications or, in selected cases, surgical interventions such as cyst fenestration, shunting, or other procedures to reduce pressure or resect abnormal tissue. In summary, porencephalic cysts are rare but important brain lesions that reflect underlying injury to brain tissue. Their impact can range from silent, incidental findings to significant neurologic dysfunction, and imaging plays a central role in understanding and managing these conditions. Thank you for listening and have a blessed day.